Hello and welcome to another edition of Britain, Health and its People. Now, we are looking today at a paper 2 practice for a 8-mark question, and my name is Mr. Barlow. Now, the learning question is, explain the significance of Islamic medicine and surgery. It's always the second question of the 4 questions from paper 2. Overall, you get 40 marks plus 4 for SPAG, that's spelling and grammar. And this is how you will earn 8 of them. Now, you should be trying to produce something mark worthy every 2.5 minutes. So just as a guide for an 8-mark question such as this, then just try and spend around 20 minutes to do it justice. Now, the higher order thinking skills on the left are to demonstrate, to explain and analyze, and then to compare over time and place for top marks. And on the right-hand side, from purple, which is the basic and simple explanation of one aspect of Islamic medicine and surgery. Hopefully you will progress to do something a bit more developed, to get into silver, which is an explanation of 2 or more aspects supported by facts. And then finally, we'll be hitting the jackpot with the bronze level, which will get you 7 to 8 marks, which is a complex explanation of the significance and also including its significance over time and also its influence over other places, for example, Western medicine. Right at the bottom are the key words for today. The Baghdad Hospital, Razes, who wrote about children's diseases, Ibn Nafis, who wrote about blood circulation, Avicenna, who wrote the Canon of Medicine Encyclopedia, Al-Bukhasis, who wrote about surgical tools, anesthesia, and antiseptics. When responding to the questions, try and for each point, create a paragraph and provide evidence, explanation, and a link back to the main question or to link onto your next point. Point 1. The significance in using ancient remedies. The early Islamic medicine drew upon traditional practices from the region, some dating back to ancient Mesopotamia and ancient Babylon in the 3rd millennium BC. So it's about 1,000 years before the time that we're studying. Muslim doctors also translated the texts of Greek and Roman doctors at a time when these ideas had been forgotten in Western Europe because of the Dark Ages. Point 2. The significance in medical skills. The Muslim doctors were highly skilled and knowledgeable, and they even had to pass an examination to become a doctor. During the time of the European Crusades, knights would only go to Islamic doctors because they were trusted for their skill and knowledge. And there are also women doctors and nurses, also eunuchs as well, employed by Islamic medicine. And for example, in Britain, women doctors were only legal in 1892. Point 3. Significance in advanced hospitals. The Islamic world had the most advanced hospitals from the 8th century, notably in Baghdad, which is modern Iraq, and Cairo, which is in Egypt. Built in 805, the Baghdad Hospital also had a medical school and a library attached to it. And unlike medieval Christian hospitals, its aim was to actually treat its patients, not just to care for them. Islamic medicine used to treat ailments with traditional natural remedies such as honey and olive oil, and used suction cups as well, which are still used today in many Islamic countries around the world. Point 4. The significance of new ideas. Al-Razi, or Razez, who ran the Baghdad hospital in around 900 AD, was the first author known to have written a book about children's diseases. He also explained the difference between smallpox and measles. This helped doctors diagnose the diseases. And top right, Ibn Nafis wrote about the circulation of blood around the body in the 13th century, about 300 years before this was known in the West. And bottom right, the extraordinary Ibn Sina, known as Avicenna, was a doctor at age 18, and he wrote a great volume called The Canon of Medicine, which became one of the most famous medical works of all time, which blended the ideas of the medical practice of Galen and the philosophy of Aristotle. It was used as a standard medical textbook in Europe for doctors into the 17th century. And point 5, the significance of surgical advances. So sorry, I put point 4 there, but it's actually point 5. Now, do Muslims advance surgery with anesthetics, that's drugs for create a loss of feeling, with using drugs such as cannabis and opium, and using mercury and alcohol as antiseptics, which removes germs. And also, the Islamic medicine and surgery had rules about hygiene. Al-Bukhasis wrote an encyclopedia called Al-Tasirif, which was the first medical book to contain pictures of surgical tools, providing clear information on how they were to be used. His book also gave practical guidance, and it was widely translated and used across Europe until modern times. So what you need to do is try and put each of those points into a Peel paragraph, and try for the bronze level, try to describe the significance of Islamic medicine and surgery over time, and also on how it influenced Western medicine as well. Thank you for listening.